During diastole, there are two sounds of the ventricular filling. The first is from the atrial walls, and the second is from the contraction of the atrium. The third heart sound is occurred by vibration of the ventricular walls, resulting from the first rapid filling, so it is heard just after S2. The third heart sound is low in frequency and intensity. The S3 is commonly heard in children and young adults, in older adults and the elderly with heart disease, and S3 often means heart failure. The fourth heart sound, or S4, occurs during the second phase of ventricular filling, when the atrium contracts just before S1. As with S3, the fourth heart sound is thought to be caused by the vibration of the valves, supporting structures, and the ventricular walls. An abnormal S4 is heard in people with conditions that increase resistance to ventricular fillings, such as a weak left ventricle.